Hello, welcome back. The topic today is insulin resistance and how it affects the weight loss. So we all know insulin is a hormone. It's very essential for glucose metabolism, and we all know if it's very less, people get diabetes or the blood sugar level rises. So it's all everybody knows. But insulin also has an other function. This is an endocrine function of the insulin. There is one more part called exocrine function of the insulin. So that is actually it increases your appetite. It also it's an anabolic. Anabolic means it's like insulin increase the weight gain. It's very essential. And not only that, if suppose somebody is not at all eating at all or even days together, but we need at least some amount of very little amount of insulin for the normal functioning of the body. So insulin has a endocrine function, exocrine function, and it's very essential for day-to-day normal functioning of the body. So this is very important. Number one, what is insulin resistance? Insulin resistance means there is too much of insulin, but it's not working, or there is a correct quantity of insulin, but the cell is not sensitive for the insulin. In either way, the insulin is not functioning. The endocrine function of the insulin is not working, but the exocrine function, exocrine, what is that? The appetite, weight gain, all these are all functioning. So that is why it's very difficult for people with insulin resistance to lose weight. Both are interdependent. Because of the overweight, people get insulin resistance. Because of insulin resistance, people gain weight. So it's like vicious cycle. So we have to cut somewhere. So what is the only way? We have to lose weight. That is the only way. So okay, so how to know somebody has a insulin resistance and what? So if a doctor means he will clinically, if he examines the patient himself, he will know because of young people or even any old people with central obesity, overweight people, metabolic syndrome. All these are very clinically very easily to assess. But to know by blood investigations, by blood they will measure the C-peptide and fasting insulin level or postprandial insulin level, and also sometimes cortisol level. So these things will have an idea that particular person has an insulin resistance. And clinically, if the patient wants to know whether they have insulin resistance that prevents them to lose weight, generally they can examine themselves. Like they have a dark circles, velvety dark circles around the neck, the axilla, the groin, in between the thighs, central obesity, especially young people with diabetes and central obesity. These are all signs and symptoms of insulin resistance. So how to reduce the insulin resistance or how to improve the insulin sensitivity? The only way is to reduce the weight. How? First is good 7 hours of good sleep. Sleep is very essential that to maintain the circadian rhythm. The circadian rhythm itself, when it comes, good sleep will increases the insulin sensitivity. It decreases the insulin resistance. Number one. Number two, some physical activity, especially aerobic exercise, and it should be daily, at least 30 to 45 minutes, at least walking minimum 30 to 45 minutes a day. Third is decreasing the carbohydrate level and increasing the protein level, or balanced diet. These are three essential things, and but it takes longer time. Somebody following these things, and you cannot lose weight within months, or it takes longer time. It takes perseverance. It takes a lot of patience. So if you feel you are overweight and you have an insulin resistance, then have a good sleep, more protein diet, balanced diet, and of course some aerobic exercise. And of course, if you have a diabetes, and it has to be treated as well. So definitely insulin resistance will prevent the weight loss. And if you have if you feel it's very difficult for you to lose weight, look for insulin resistance and get your doctor's advice. Thank you.